the indications for external jugular vein IVing is for a patient who you cannot gain access in any other peripheral veins, or it's most commonly used in cardiac arrest. Some of the risk factors of gaining external jugular vein access is you can accidentally pierce the carotid artery, you can cause an air embolism, you can cause a pneumothorax, or you could accidentally pierce right through the vein and cause a hemorrhage. To expose the jugular vein, there's many ways. You can lie the patient flat and elevate their legs. You can ask the patient to bear down if they are conscious. You can also put pressure on the liver, which will then cause the hepatic jugular reflex. You can also turn the patient's head laterally opposite the side that you want to gain access and tamponade near the clavicle, which will expose the vein. For my equipment, I have my correct PPE. I've got my gloves and glasses. I have a swab so I can clean the area. I have my IV cannula, which would usually be a 14 gauge, but for the purpose of this mannequin I have a 20 gauge. I have saline, which I'm going to attach to the cannula to prevent the air embolism, and I've also got a 5mm syringe which I will draw up 3 mils of saline. I have my lure plug. I've also got a saline flush once I have gained access. I have a tegaderm and a gauze pad, and also I have my sharps container. So firstly I want to do my drug check, so I'm just going to make sure that this is sodium chloride 0.9%, 90 mg and 10ml, and expires June 2020. I'm just going to get my offsider to check that.
Got sodium chloride 0.9%, expires June 2020.
Awesome, thank you. And I'm also just going to drug check my flush, so 0.9% sodium chloride and 10 mils, and expires 2021.
Got 0.9% sodium chloride and 10 mils, and it expires 2021.
Awesome, thank you. Cool. So I'm just going to swab the area. So I've turned this head laterally. I've found the external jugular vein. So now I just want to swab in a circular motion moving out. I'm also going to swab my hand just so I know when it dries. And now I just want to draw up my saline into my 5mm syringe. So just drawing up 3 mils. Cool. And I'm just going to keep that on so to keep it sterile. So awesome. And now I'm just going to attach my saline to my needle. So at this point I will gain consent if they are conscious, and making sure that that head is still lateral. And I'm going to remove my cap somehow. Yep. And tamponade the vein, sharps out, and tamponade the vein, and also using my thumb here to cause traction. I want to go in at a 15-degree angle. And also now I just want to flash, obviously I got flashback, so now I'm going to go at a negative pressure and insert a little bit more. Cool. Keeping that traction, I'm just going to insert the cannula. Now I'm just going to move my hands a little bit further to tamponade and take that syringe out and put it straight into the sharps container. Also going to get my lure plug and attach that onto there. Cool. So now I've got I can remove my fingers. I just want to flush some saline into the IV, making sure that I got flashback. Yep, so it's still in the vein. Insert that. Awesome. Cool. I'm just going to put that in there. Oh, there's my tegaderm. I'm just going to secure my IV. Sticky things. Cool. Just going to secure my lure plug. And also going to add the date and the time that I have inserted this IV.